Welcome to this edition of the First Aid Show. In this edition, what we're going to do is look at when to call for assistance, when to actually activate the emergency medical services, and what sort of things you need to do. As soon as you find out the patient is not breathing, call the emergency medical services. It's vital for rescuers to get help as quickly as possible when someone collapses or appears unconscious. If you've not called for help, delivering CPR without the EMS on the way will not help them. For every minute it takes for the AED to arrive, the person's chance of survival drops by 10%. Ensuring the EMS are on the way and effective CPR will increase the patient's survival chances. When more than one rescuer is available, one of the rescuers should start resuscitation while the other goes for assistance and tries to find an AED. With adults or older children, if only one rescuer is present, go for assistance as soon as you find out they're not breathing and then start CPR. Do not go looking for an AED, the EMS will bring one. As you've been delivering CPR, their chance of the AED restarting the heart will be increased. With children and infants and victims of drowning, if only one rescuer is present, undertake resuscitation for about 1 minute before going for assistance. To minimise interruptions in CPR, it may be possible to carry an infant or small child with you while summoning help. The only exception to performing 1 minute of CPR before going for help is in the unlikely event of a child with a witnessed sudden collapse when the rescuer is alone and primary cardiac arrest is suspected. In this situation, a shockable rhythm is likely and the child may need defibrillation. Seek help immediately if there is no one to go for you. When you dial the EMS on 999 or 112 or your local number, ask for an ambulance. If there is someone else with you, ask them to call if possible. Otherwise, call them yourself. Whilst they make the call, you can begin CPR. If you're alone, stay with the victim when making the call if possible. Activate the speaker function on your phone to aid communication with the ambulance service. Send someone to get an AED if available. If you're on your own, do not leave the victim. Start CPR. It's important to keep blood circulating, and by leaving them to find an AED, their chance of survival is reduced. You can get additional help on CPR by speaking to the dispatcher when you call the EMS. By having your phone on speakerphone, they can guide you through CPR as either full CPR or chest-only compressions.